Modgil. I'm ENT consultant working in India, Hyderabad, in the hospital KIMS Secunderabad. So today we have our topic tinnitus and the impact of using earphones in this COVID era due to excessive use of earphones. We are getting multiple and many queries regarding the earphones, as well as the tinnitus has definitely increased in this particular time. Next, please. So first, we need to understand what exactly is the tinnitus. Tinnitus is a ringing sound which is produced inside the ear. So the main concern with the patients is they think that tinnitus is a disease. So we have to understand this particular concept that tinnitus is not a disease. It is a symptom, like fever is a symptom of malaria, dengue, COVID, many other fevers, many other infections have a symptom of fever. Similarly, there are many causes which lead to tinnitus. So we cannot treat the tinnitus. We can treat the problem or the ailment leading to tinnitus. So what exactly is tinnitus? Tinnitus is a ringing sound which is produced inside the ear. It can be one ear, it can be both the ears, and patients, they feel it more when they are sitting in a silent place, especially at night time or in the winter season. So it is a wheeze sound which is produced, and there are various types of sounds, various types of definitions which patients explain to us when they come to us in our OPD. So next, please. Yeah. So this is the different types, the way the patient explained to us. Like they say they are having ringing sensation, they're having hissing sound, they're having buzzing sound, like some bees buzzing inside the ear. There is a roaring sound, there is a clock tick 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 sound, there is an ocean wave sound, there is cicadas, is an insect in the jungles, and pulsing heartbeats also. So they all come in the basically descriptive labels of the tinnitus. So now what exactly is causing the tinnitus? That is the main concern for any ENT doctor, any doctor you're visiting, that we have to understand basically that tinnitus is coming from some problem which can arise not only from the ear, it can be central, it can be peripheral. So peripheral is including the ear as well as the cardiovascular system, some nervous system problem, and central is the brain. So let us first see what exactly is causing the tinnitus. Next, please. So this is how much is a lot of tinnitus. Any Google click you will let you know that in any given country, 10 to 25% of the population is suffering with tinnitus. So this is the general understanding. This is how is the prevalence of tinnitus in the present world, right? Next, please. So there are two types of tinnitus. 99% or 95% of the patients are having subjective tinnitus. Subjective means only patient can hear the tinnitus sound. A doctor or the physician to whom they are going or any family member cannot hear the sound when they come closer to the patient even. It means it is coming inside. It is inside the body. It is coming from the body, inside the body. Nobody around you can hear the tinnitus. That's why it is difficult for the patients to make others understand what are they basically suffering with. And very few, like 2% patients, they have objective tinnitus. And it is usually because of some blood vessel problem, increased blood supply, or there is some obstruction in the blood supply, which is causing angiogenesis. And these particular causes can lead to the tinnitus, which a doctor can only hear if they are coming closer to the ear or they put some stethoscope just near to the ear. That is a pulsatile fish sound which they hear. AV malformation, arteriovenous malformation. Usually such type of tinnitus, which is objective, which a physician can hear, they do not arise from the ear. The cause is different. It can be twitching of the muscles also. So next, please. Now coming to the tinnitus cause. Mostly patients, the cause of tinnitus is definitely in the ear because they are listening the sound in the ear. So most of the patients with the tinnitus, the cause is inside the ear. And 85% of the patients who are having the SNHL means sensory neural hearing loss, they will have tinnitus. So there are many other causes behind, other causes other than the hearing loss, which is important for us to understand, for you to understand, so that you can approach the right doctor. Can we have a next slide, please? Now, this is one important slide for all of us. I told you that hearing loss is one major factor in which patients have the tinnitus, especially in case of other sensory neural hearing loss is one which I explained in the previous slide. Other than that, that noise-induced hearing loss. Now, what is noise-induced hearing loss? There are two types of noise-induced hearing loss. One is the acute, like you are exposed to the more than 120 decibel or 150 decibel of high frequency sound in some DJ music or some temple or some gathering, and you immediately started having a numbness, like no hearing from the ear or less hearing from the ear. That is an acute noise-induced hearing loss. Usually, such type of hearing loss lead to tinnitus also, but this is usually transient and reversible. And something is called slow noise-induced hearing loss, progressive noise-induced hearing loss. For the patients who are constantly using the headphones or earphones, being exposed to the high-frequency sounds, and working in some mills or some factories where they are exposed to certain type of sounds of machines around them. So these patients slowly and steadily, with number of years and number of months, maybe depending on the genetics. Because what happens, the noise, it will go inside and damage the hair cells, which is a part of it's not the hairs over here. I'm sorry, but then it is the hair cells. They are very minute, microscopic organ inside the ear, which is a part of inner ear. So they get damaged. And how the patient will have the damage, which patient will have the damage, which frequency, in how much time, sometimes it is genetic predisposition too, right? So it is like noise-induced hearing loss can be acute or can be from progressive noise. And then some problems in the ear, like the patient is having some wax in the ear, they can have tinnitus. There are some patients, they have a blockage in the tube which is connecting nose with the ear, which lead to some fluid collection behind the eardrum. It can happen in a patient who has gone in a flight also, or maybe some upper respiratory infection leading to the blockage of the tube. So this fluid collection can lead to tinnitus too. Right? Then there are some tumors in the nerve bundles. There is a nerve which is responsible for hearing, and along with that nerve, there is another nerve which is responsible for maintaining the balance of the body. So when there is some tumor which is there in the nerve, we call it cochlear nerve. So acoustic neuroma. There are some type of, they are basically connected with the nerve, but this is a central cause again. Because acoustic neuroma is a tumor which can definitely disrupt the neuromodulation or the nervous system, which is responsible for taking the sound from the outside environment inside the brain, so that nerve pathway get disturbed, leading to the neuron, leading to the tinnitus. It's very rare. My purpose of this particular Facebook Live is to aware you, not to scare you, right? So we cannot sit at home dealing with the tinnitus ourselves, right? It's our right to go and see the doctor. Is my tinnitus reversible? Is my tinnitus treatable? I understand that you will keep on reading your Google post and many groups of tinnitus too, where you will definitely get more people saying that tinnitus is not treatable, tinnitus is not treatable. I really do not second it, but I support them. I agree that most of the time tinnitus is not treatable. But if it is only because of wax and you're sitting at home dealing with the tinnitus yourself, looking into the Google post and looking into the friend's opinion that no, tinnitus is no treatment. So it is just like you just come to doctor, get your wax removed, and you are getting rid of the tinnitus. So do not sit with the tinnitus at home. Please come out of your slumbers, come out of your comfort zone, see your ENT doctor first. And if they think that the cause for tinnitus is not inside the ear, it can be something else, maybe related to some nervous system, maybe related to cardiovascular system, then they will refer you to the right doctor. Now coming to next other, there can be some medications. There are some medicines like norfloxacin, they have an impact on the cochlear system, like cochlea or the hearing in part of the ear. And these medicines can transiently lead to some anti-cancer drugs also. They can cause temporary tinnitus sometimes. And then sinus issues, which I have already told you. that if we have upper respiratory infection, then the tube connecting nose with the ear can lead to some problem in the ear behind the eardrum, leading to tinnitus. Then sometimes patients are having problem with this joint. There is a joint which connects your upper jaw with the lower jaw, and it lies here. And if there is a constant strain of the muscles in this particular joint, then this TM joint problems can lead to tinnitus too. They can lead to some clicking sound of clicking type of sounds basically. Then multiple sclerosis is one of the neurological disease which can lead to tinnitus. Many patients are having a lot of stress and anxiety. They can have tinnitus. And cardiovascular is something which I have covered many times in previous discussion, that any problem in the cardiovascular system leading to decreased blood supply or increased blood supply, AV malformations can have tinnitus. So in the tinnitus part, the most important part is to understand what are the reasons for tinnitus. Second important part, that tinnitus is not a disease. It is the consequence of all these problems, one or two, any one of them you can have, and it's your right to come out, see a doctor, and find out that what is the reason behind the tinnitus in your case. Two people with tinnitus cannot have the same cause. They will have different cause. Next slide, please. Now, 20%, these are just data. They may differ from country to country, type of population, but then it's my duty when I'm coming here for the Facebook Live to make you aware that what is the impact of tinnitus on our population. 20% of the people with tinnitus are bothered by the tinnitus. Tinnitus itself is not a problem, which I told you earlier also. Problem is reaction. And it applies to everything in our life, same with the tinnitus. Tinnitus is a monster, and reaction to it is a main problem. How you deal with the rest of the problems in life, this is how you have to deal with tinnitus. And you are not here alone. Many problems in our personal life, we deal with them alone. But for tinnitus, we are here for you. It's just that you have to come out of your comfort zone to come to us, to find out the reason behind the tinnitus, to get the counseling behind the tinnitus. It can lead to irritability, fatigue, sleep disturbance, depression, suicidal thoughts. It can be this much debilitating too. These patients need to be referred to mental health professionals when they suffer to a certain extent. Next, please. So this is what I'm saying, the reaction part. So let's concentrate that how the reaction to tinnitus can worsen it. Now, patient is giving attention to that tinnitus. Oh, I'm having the sound, I'm having the sound. They wait for the night and they keep on listening to it constantly for an hour, 2, 3. They get up at night time, they keep on listening to it. They concentrate, they give a lot of importance to tinnitus. Right? They get an emotional reaction inside. Like anything in our life, if we give a lot of emotional reaction, either a lot of happiness, a lot of fear, or a lot of anger, whatever emotional reaction we give in excess, can basically activate the limbic system, autonomic system. It can basically increase more stress. And this particular stress will increase the decibel of tinnitus, which you are feeling. This is a vicious circle. So now the tinnitus will increase in intensity. You will concentrate more on it, giving more emotional reaction, and then more stress, and then more tinnitus. So this is a vicious circle which is not going to break. Right? So the reaction to the tinnitus is in your hands. The treatment to tinnitus is in our hands. So next slide, please. Now coming to the treatment aspects of the tinnitus, you all are aware about the tinnitus treatment, those who are suffering with tinnitus, because they do a lot of Google search on that. Not bad, because they're suffering. Definitely they need to find out the solution on Google or any other site or in WhatsApp group or somewhere. But it's my duty to make you aware about the treatment which we are having for tinnitus. Next, please. Nowadays, we know that any holistic approach, even if you are suffering from cancer or any other problem in your life, holistic approach to the health is the treatment. In similar way, for the tinnitus, holistic approach to your health, to your mental health, to your emotional health, to your physical health, is the first treatment for tinnitus. Our work is half done once you have a holistic approach to your life. Diet, physical activity, social activity, recreational activities, hobbies, stress reduction, hearing protection. I will not go into each and every aspect of the holistic approach, but you are yourself aware about all this. It's just the actions which you do. Being aware doesn't help you much. You have to take actions. You have to get up morning and just gut up your lines to have a holistic approach to your life. And then we can basically help you more with the tinnitus. Next, please. Now, apart from the holistic modality, the remote control of your holistic approach to your health is in your hands. And then we play a role. ENT doctors play their own role. So we have the treatments which are available. Now, first, before coming to the treatment aspect, for the tinnitus, there are many treatments available. I'm talking about the tinnitus, which is idiopathic, means there is no cause behind it. We have examined the patient completely. We know it is not a hearing loss. It is not because of menials. It is not because of bags. It is not because of any middle ear disease, any kind of autosclerosis, fluid, or any inner ear damage. Nothing. We are not finding any cause in any of the investigations or our examination or history taking with you. We are not finding any cause. Now the patient is under the care of idiopathic. And idiopathic patients with idiopathic tinnitus, there is a good amount of patients in that. So for in certain cases, we try to treat the patient with multiple modalities. Now these modalities which are mentioned in the slide, it's not that we try with one modality, then we go with another modality. Sometimes we just use one modality at a time. Sometimes we try our hands with 3-4 modalities at a time, depending on the patient mental or reaction to the tinnitus, how much are they impacted with the tinnitus. So, and all of them, most of them are like, most of them are in the research phase, and they have done treatment of like 1,000, 5,000 patients with this particular modality, and significant number, like 60% patients, they have given the response, and 40% patient didn't give response. It's an example. It's an example. I'm not exactly quoting the number, but it's an example. So all these things are part of our research process. And we have treated patients also with that. But then it can be a possibility that you are among that 60% patients who got relief. And unfortunately, you are among those 40% patients who didn't get relief. It may be that you are so stressed, you are not having the holistic approach to your lifestyle. You are not sleeping properly at night time. You are alcoholic, you are a smoker, you are diabetic. It can be anything. That this particular modality is not working on you, but it is working on the rest 60% of the population. You are in this particular arm of the treatment, 60% or 40%, it's completely unprotected. We have to understand, we have to know that there are modalities. It's not that you come to us, we say it is idiopathic, sorry, our hands are up, we cannot treat you. It's not like that. Technology has definitely advanced. Now the treatments available are, we have hyperbaric oxygen therapy, in which we give there is atmospheric pressure of oxygen. There is a chamber in which a patient has to sit for some half an hour time, and 1.5 atmospheric pressure of oxygen therapy we give to the patient, and we can give it like weekly for 6 to 7 sessions. It can help in improving the inner ear hair cell damage which has happened because of some idiopathic disease. Another modality is sound therapy. There are different sounds which can help as a masking. We'll come to that in the next slides, but then sound therapy is one. Then tinnitus retraining therapy, in which again the maskers are another function. That's one of the modality in the tinnitus retraining therapy. Noise generators, hearing aids. Patients with SNHL, we told you earlier that patient with sensorineural hearing loss. If we are having 10 patients with SNHL, 7 to 8 of them will have tinnitus. So these patients, when they start using hearing aids, they improve. They really improve in a good manner. After 3 months of using continuously the hearing aids, tinnitus goes significantly. That they really don't bother about the tinnitus. The intensity of the tinnitus goes down significantly, provided the tinnitus is because of SNHL. Then there are some tinnitus instruments. Going into the details of it is beyond the realms of the general public discussion, because it's for the general public. So I will keep myself confined to the terms so that you are acquainted with the terms and take the help of the doctors by the knowledge which you have from this session today. And then cognitive therapy. Some patients who undergo stress, anxiety, we have to go with the cognitive therapy with them. We have to make them understand that, counsel them that this is not something which is life-threatening. It is not something which is going to worse with time, or you are not having cancer. Basically, they are really concerned if they're having some cancer in the brain, or what if they will diagnose with the cancer later, which is in the later stages. So such type of cognitive therapy we need to give to some patients. Then music therapy too. Next slide, please. Now, if a patient is having some problem, like patient is having acoustic neuroma, we can treat the patient by removing the acoustic neuroma with surgery. Patient is having autosclerosis, and we can treat the patient by doing the staphylotomy, is a procedure which we use to treat the patient for autosclerosis. Autosclerosis is nothing, it is the stiffening of the bones, which are the hearing bones in the ear. We have 3 bones inside the ear. There's a stiffening of them, they do not move, right? So to make it possible, like to make it mobile, we put a piston, we call it staphylotomy. And if there is some external ear tumor, maybe some osteoma, some bone tumor or something, we remove it. And depending on that, on the cause behind it, if it is, we need a surgery for that, so surgical treatment. And then medications we give, depending on the cause again. And going into the details of medication is definitely is not going to help you, but then there are medications for the sinus problem or the cardiovascular problem, and if there is any infection in the ear, like that. Depending on the cause, there are different types of medications. Please, next, please. Right. So masking is a very common treatment, is a new advancement. Definitely, it's been in the medical sector for a very long time, in the audiology or ENT sector for a very long time, and many advancements have come for the masking aspect of the treatment in tinnitus. So usually we give the patients, either we call them for the sessions in which we provide them some type of sounds. We call them pink sounds, blue sounds. There are some terms which are fancy terms which we use, but just for the understanding, we first map the patient. We take the patient into the audiology room. We map it. We map it, and it means that we see in which particular frequency how much decibel of tinnitus is coming. Now we know that this particular patient is having some 40 decibel of tinnitus in 4K or 4 kilohertz of frequency or 8 kilohertz of frequency. So we mask that particular area. So masking can be done with different types of sounds, and which we can provide by sessions, or we can provide either in the form of a hearing aid, which will be with you all the time inside the ear. So nowadays we do not have the hearing. We have the hearing aid which is coming from here and going back on the back side behind the ear. We do have it, but then with time we have come with very good cosmetically beautiful hearing aids which are not visible to anybody. They're just this small. We can customize it according to the size of the ear canal which you have, the opening of the ear, and you can use them. And after a few months of using the maskers, customize for the type or the place where you're having the tinnitus, like which frequency and which intensity, you may feel the relief. And may I have a next slide, please? So like this is the same thing which I am speaking again and again. So there are companies which make the tinnitus maskers for those with normal hearing. Like I told you, patients with hearing loss will have tinnitus. Sometimes patients with normal hearing can have tinnitus. For them also the maskers are available, but those maskers are again in the form of the hearing aid, very small, thin, concise, like not visible to the people around. It will go inside the ear. So May I have a next slide, please? So I told you about that the types of sound which the audiologists use for masking the tinnitus are white noise, pink noise, brown noise, gray noise. There are different frequencies for this particular noises, and they use it for tinnitus retraining therapy or masking or making the maskers for you, customizing it especially for the patient with the type of tinnitus they have. Okay, so I think we can go for the next slide. This I have already told you about tinnitus retraining therapy. We give it like 15-20 minutes of session weekly. We can give like 5 session, 10 session, depending on the response from the patient coming. And it may affect to some amount of population, not everybody. Next, please. So Neuronomics. This is another set of treatment. It is very expensive, and unfortunately, we do not have it in India. If there is a center which is there in India, maybe I'm not acquainted with, but as per my knowledge and my contacts, I am aware about this particular Neuronomics treatment is not yet available in India. Maybe a center in Bangalore was few months back telling that they are bringing it. They have brought it or not. I'm not aware about it. But then Neuronomics is another treatment which is upcoming, may come with time in India too. It's pretty costly. It's $5,000 for the treatment. And they basically provide you different types of stimulus, like a physical vibrator and then sound to different types of sounds inside the ear. And there is a particular machine which is made for it, kind of equipment for this. And the experts, audiologists are the experts, and they are different type of people. I mean, the audiologists, they do have to train themselves for this new equipments. So Neuronomics is one upcoming treatment for the tinnitus. And apart from the Neuronomics, we are having few more advanced treatment which are coming. Now the question arises that in how much time we will be having these treatments in our country in various places. In next 5 years, at max like 7 years, many centers will be equipped with these types of advanced treatments, because definitely the companies who are making these treatments are in phase 3 and phase 4 trials. And once they are getting the phase 3 trial, they are getting the approval from the FDA or other drug associations, it will definitely start coming up in the market in a good amount, because the patient load is quite high in tinnitus. May I have the next slide, please? So this is another recent advancements, like acoustic neuromodulation. It is again going on, and magnetic and electrical brain stimulation. So this is like knowing about the terms is like more than enough for our session. But then talking about the tinnitus, which I have told you, we have another topic like impact of hearing using earphones. So you can please ask me question if you have. I will appreciate that. But then I'm moving forward to next topic, that is impact of earphones. And impact of earphones are like that. Nowadays, because of this corona thing, many of the patients are taking up the sessions, like they are taking the meetings, working from home, and all the meetings which used to happen physically in the companies are happening through earphones, like systems and all. And the usage of earphone has increased tremendously. So this is, I really would like to make them aware about hearing using the earphones. In just, it will take hardly 3 minutes about it, but it is must for us to understand that the earphones, when we use it, it has many bad effects on our ear. So what are these? When we use the earphones, they snugly fit into the ear over here. When this snugly fits inside the ear, the oxygen cannot go inside the ear. Definitely, it will impact the quality of wax which is formed. So the wax will be more hard in that case. So it will lead to impacted wax inside the ear. There will be more sweating in the ear. It will increase the humidity inside the external auditory canal, like inside the ear. And these patients with more humidity inside the ear, they are more prone to itching, and they are more prone to fungal infections inside the ear. And the patients which are using the earphones, like they are sitting in a crowded area, and they are increasing the volume of the earphones. The problem is not the decibels. We all know that having a high decibel sound is definitely harmful, but the problem with earphones is it produces high frequency sound. So frequency is different and decibel is different. So these earphones, they produce high frequency sounds, and these high frequency sounds have deleterious or a very bad effect on the hair cells, which are responsible for the hearing. So they slowly and steadily they damage the cells. And after a few months of constantly using these earphones, patients start feeling tinnitus. They start feeling hearing loss also. This is how the earphones impact. Now there is something called headphones, and there is something is small earphones. So if we compare the earphones with the headphones, anytime headphones are more useful, are better and more human friendly than the earphones. The reason behind is it does not snugly, it is just around the pinna. So it is not disturbing the ear oxygenation. Definitely it covering the ear oxygen, it is disturbing the oxygen going inside the ear, but it is not snugly fitting inside it. One aspect. Second aspect, that as it snugly fits around the ear, so it basically, there are some sounds around us, like 45 decibels, 30 decibels of surrounding sounds are there wherever we are sitting. So it does not let that particular sound disturb your listening from the headphones. So you end up decreasing the volume on the headphones. So you end up getting exposed to less decibels when you're using the headphones as compared to the earphones. Now with time, many companies have started providing the speakers, and that is a better way in future, because work from home has become a part of many companies, and that is going to be their culture, that's going to be their policy, and that is going to be their part for lifelong. It's good for them, but then it is mandatory for every company to provide with the speakers so that they can attend the meetings where they are not participating, they are not speaking. In that case, they can use the speakers. Instead of using every time earphone, headphones, kindly attend few meetings on speakers. And the kids who are habitual of listening to the music on headphones, they definitely have to change their behavior. They have to find another way to listen to the music, and they have to decrease the use or the amount of time they are using the earphones. So this is all about tinnitus and the earphones and the headphones. I will appreciate if you can ask me any questions. I'm ready to be.